and we go with this presentation about facial rejuvenation and beautification with hyaluronic acid. We're gonna talk about how we can use at best of its possibilities hyaluronic acid, and in particular we are gonna talk about a line called Hyalur, which is a line of high-tech dermal fillers. And we're gonna see why they are so-called high-tech. They are produced in Europe, in one of the best establishments of Europe, in Switzerland, to be exact. And we're gonna see all the potential use of those fillers. Let's start from the beauty concept. What is beauty? Beauty is a mix of proportion and harmony. There is no beauty if we don't respect proportions of the face, and no beauty if we don't have harmony between the parts. So with proportion and harmony, only with this we can get acceptable aesthetic results for our patients. And only with this concept we can build an effective anti-aging program for our patients. We can talk about prevention, or we can talk about treatment for the aging process. Anyway, what is aging? We all know that aging is consequent to intrinsic and extrinsic factors that both affect facial volumes and skin quality. In practice, we have in aging some biological changes in our skin, like some changes in molecular structure or of DNA, which has some damages along its chain, molecular changes in proteins and lipids of the skin, and all the combination of this is the basis of cellular aging. If we take a close look at dermal layers, and we compare between young skin and older skin, we see that in older skin there is less collagen and there is more type 3 instead of type 1 collagen, and there is also a depletion of glycosaminoglycans such as hyaluronic acid that we are going to integrate with our treatments. This is scanning electron micrographs of a young skin and old skin, and we see that in older skin collagen fibers, they look like broken. There are two kinds of aging. We have photoaging and chronoaging. Photoaging is mainly due to the effect of sun on the skin, and most of this photoaging we treat with lasers or chemical pills. We have chronoaging, which instead is due to the time itself, and most of this is made of wrinkles, what we call wrinkles and folds that appear on our skin. Why all those wrinkles appear on the skin? Mainly because there is a process of fat resorption. This is the image of a young face and an old face, and you can clearly see how fat pads are consumed in older face. Same, in fact, we have loss of fat along the main areas that show wrinkles. For example, the forehead, glabella. We have an important atrophy in the mid-face because we have atrophy of the bisha fat pad, and we have atrophy of the face around the lips and also around the mandible with prominence of the chin and jaw area. Also, beside the fat, what is resorbed is the bone. Also, beside the fat, what is resorbed is the bone. In fact, we have an important visibility of aging process around the orbit area with changes of the eye shape, around the mid-face, especially in the maxilla area, and also along the mandible and the lower third of the face with the loss of definition in the lower border of the face, and a descent of soft tissues of the lower face and of the neck. What does mean to make a patient younger? It means mainly to restore the volume. What are the areas where we can inject hyaluronic acid? Mainly all around the face, and we can in particular treat forehead and temporal area. We can treat malar area, mandibular area, and lower jaw. We can treat glabella, palpebromalar groove, nose. We can even remodel the nose, perioral area, and nasolabial folds and marionette lines. But we have to make attention to some very important concept. I just choose to show you this picture of a very famous Italian actress in her 20s and her 40s. What happened to this beautiful actress? Recently, she went to very famous TV show like Big Brother, and so she appeared in television, Italian television, as very natural. This is the same lady without any makeup. What do you see? You see that maybe her face is a little bit overfilled. So the message is, yes, we have to treat the aging of the face, we have to restore the volume, but pay very much attention to respect what we said, harmony and proportion, and do not never overfill the face. Just to remind and remark what is hyaluronic acid is maybe the main component of extracellular matrix of our skin. And we can, of course, produce hyaluronic acid with some biolaboratory passages that include bacterial lines and culture. And once we create hyaluronic acid chains, we can choose if we want to have them free as free chains or reticulate chains connected between them. So most of the fillers are cross-linked, and in many cases they are linked with butyl glycol 2-glycid ether, BDDA. They can have a biphasic or monophasic structure, and they can have different concentration of hyaluronic acid, usually from 16 up to 25 milligrams of hyaluronic acid per milliliter. As I said at the beginning, Hyalur is a company that produces high-tech dermal fillers with many different characteristics, and I'm gonna show you all the line of fillers of Hyalur. And so we have different products to treat different problems, each product with a proper aim. We have the main line with 3 products, which are the Hyalur Intense, Hyalur Style, and Hyalur Restyle. And recently, they have been introduced a line with the lidocaine inside. Maybe you are not, this is still not available in Mexico, but is gonna be available soon. And so they are Hyalur Sweet Touch with the lidocaine and Sweet Kiss for lips. And also the new product of this line is the Sweet Deep, which has lidocaine inside, as 25 milligrams per milliliter of hyaluronic acid. So it's very volumizing, and it has one of the highest stiffness capabilities of the market. This is very good to treat tissue lipoatrophy, to go in the subdermis place. And it's a very volumizer, but with a minimal extrusion force. Which are the main characteristics of the Hyalur fillers? Are the balance between viscosity and elasticity. This is quite unique of these fillers. And what does this mean in practice? This physical property means that they are easy to inject, so you don't need to make very much force to inject. there is less evidence of the product in tissues because the product is very plastic. It integrates in the skin, especially if you massage the product after injecting, there is a very good integration. And they are very long lasting because of their chemical characteristics, and in general, they give a beautiful natural effect. What about safety of these products? Safety is a very important issue for the company. As I said, it's a very reliable company with production in Switzerland. All the products have the CE approval, have a very high quality control with the ISO certificate, which means that all the passage of the production are very high standards. They give no fibrotic reaction because of their balance between viscosity and elasticity, very low inflammatory response, and moreover, very important, they have the lowest certified endotoxin level in the market. So they are very, very safe and also long lasting with a high rate of permanence in tissue because of the chemical structure and quality of cross-linking. Their duration, it depends mainly on the place where we are using, but it can go from 8 up to 18 months following implantation, especially in some areas which are not very subjected to movement, like in nose. Yesterday I saw a patient I treated with rhinofiller nose remodeling 3 years ago, and she still had some product in her nose. And they give a very high hydration of the skin. Let's see in the specific the main products of Vialor. We have the Restyle, which is made of 18 milligrams per ml of hyaluronic acid together with glycerol. And this has a very high molecular weight, which means that we can treat with this product places that we want to hydrate in the skin, in the superficial layers of the skin, like fine wrinkles, peri-eyelids, perioral area, and we can get with this product a very significant hydration of the skin. We have the Style, which has a concentration of 23 milligrams per ml of cross-linked hyaluronic acid together with free hyaluronic acid, which has a biostimulating power. And so with this product, we can safely treat crow's feet, fine facet wrinkles, and perioral wrinkles. This is an example of a patient I treated with Vialor Style. You can see her before and after the use of 4 milliliters of Vialor Style. I treated mainly hair superficial and even not superficial, some deep wrinkles. You see the glabellar area. I treated all the periorbital area, and you can clearly see how she got better in the perioral area, how the skin were hydrated and the wrinkles were fulfilled. This is another patient I treated with Vialor Style in the perioral area. I just did I did the barcode and the lip border. And then we have the Vialor Intense, which is my favorite one. It's a highly cross-linked filler, monophasic structure, 23 milligrams per ml of hyaluronic acid. And I think this is the more versatile product. You can do mainly everything with this product, especially if you want to treat nasolabial folds or even every kind of deep fold and wrinkle, or you want to do cheek augmentation, chin contour, or lips. This is my favorite one in the lips, actually. For example, in this patient, I used 3 milliliters of Hyalur Intense in the cheek and zygomatic area, and you can see especially the nasolabial folds, how they were filled and they disappeared completely. In this patient, I used 2 milliliters of Hyalur Intense just to give a little prominence to her cheek and to restructure facial ogiva. In this patient, I treated the perioral area and lips. I got very much hydration and beautiful full lips. Same in this case, 1 milliliter just to give hydration and invert the lips. In this patient, I remodeled the mandibular angle and the jaw area. And in this patient, I mainly treated all the lower face. You see how I got some support of her skin, and so all the lines, almost all the fine lines disappeared. This is a patient I treated with mainly all the Hyalur products, both the Restyle, the Style, and the Intense, and I use a different technique, both needle and cannula. In particular, I use the Restyle to hydrate the crow's feet. I use the Intense to give support to the mid face and lower face, along the cheek and along the jaw area and marionette lines. And I also use the Style to treat fine wrinkles of perioral area, nasolabial folds, and also nasolacrimal groove. You see how much she's better after in the periocular area. I did no surgery, just I used the cannula in the periorbital area and I injected Hyalur Style. I just want to talk a little bit about minimally invasive procedures because I think this is very useful and actual for our patients. If we propose something that is minimally invasive, patients are happy because they have less pain, less complications like bruising or ecchymosis. And this we can do with the use of cannulas. With cannulas, we can be less invasive because we can have a single entry point to treat a whole area. We have less bruising because, of course, the tip of the cannula gives no bleeding because it's blunt. And we have also less pain because the cannula is flexible inside the tissues. And so the treatment is virtually painless. So we can very accurate, effective, and safe with cannulas. So always when you treat, especially when you treat mid-face or lower face, consider to combine the use of those fillers with cannulas. Just a little example of how to use the cannulas. You can choose to make a little anesthetic in the entrance point, like 2% lidocaine, just 0.1, 0.2 cc injection. Then you create an access with the needle and you insert the cannula. You can use a 25 gauge or even 27 gauge for those fillers, for all those fillers, including the Intense. And you can inject with a retrograde technique. This is an example of treatment with cannula for mandible definition. You can treat also the nasolabial fold that you see in the image, and you can treat the lips with cannula. Just with one single entry point at the lip corner, you can enter to treat the lower lip, and then you can switch to the upper lip. And then if you want to give a little touch up of definition, you can after use the needle. This is an example of lip treatment with cannula. As you see, there is no hematoma, very few swelling, and so after treatment is easier for the patient. This is a patient where I treated the cheek area, zygomatic area and cheek area with one entry point at the top and one at the bottom. And this is a before and after treatment. Just some tips and tricks for you. I wanna focus on the entry points. When we use the fillers, there are some danger areas in the face that we have to take in mind because of their specific anatomy and the fact that vessels are very superficial in those areas of the face. For example, we have to take in mind position of anterior auricular artery at the radix of the helix when we treat the zygomatic area. We have to take in mind the submental artery when we treat the jaw area. We have to take in mind inferior labial artery and facial artery when we treat lips and nasolabial folds. We have to take in mind angular artery when we treat the nose, and supratrochlear artery when we treat the glabella. So which are, for example, take a look at the position of facial artery. It passes quite superficial at 2 centimeters for the lip corner. So this is a point to avoid when you use the needle and you inject filler. So which are the safe access point? The central portion of the glabella is safe because it's free of vessels. The central third of the lid check junction is safe. The lateral third of zygomatic body is a safe area. Central cheek is a safe area unless you go very deep and you can get the infraorbital artery and vein. Alar cheek groove is a safe entry point. 2 centimeters inside or outside the oral commissure, you can avoid the facial artery. Mandibular angle is safe and the chin is all safe. What to do if you have complication? You maybe have all read this publication or something like this. You need to massage. You need to use maybe some hyaluronidas, warm compression, or you can also use oral medications like aspirin, steroids, and something to improve vascularization of the area where you had the complication of intravascular injection. Or you can use hyperbaric therapy of PRP for tissue salvage and regeneration. So let's go to see some live treatment. Actually, treatments are not going to be live because it would have been very difficult to have a full range of treatments. So I did the treatments and I made some videos, and I'm gonna show you the patient analysis and videos of some different areas I treat with hyalur fillers. First patient, she came with a moderate deflection of the central face and lower face. She had some fillers before in the nasolacrimal groove, but she didn't like the set and tired aspect of her face. So I just drew the areas that I want to fill and I want to improve. This is very useful in patients when they are standing up in front of you. You have to sign the areas that you want to treat because anatomy is going to change completely when the patient is lying down. So always do this before to treat the patient. This is the treatment. I treated her with 2 milliliters of hyalur intense. As you can see, the patient is lying down, but my lines are still there and are going to guide me in the treatment. Of course, you start with skin disinfection. I go in the nasolabial fold before. When I use the intense, I like to give a deep support. So first I inject the deep subcutaneous, and then I go with further passages without Xing the hole. I go up and up. Still, I go intradermis to give superficial hydration of the line. other side, I enter. As we said, the nasolabial, the alar groove is a safe area. I have no superficial vessels in this area, so I can go without any risk if I'm not too deep. I go in the subcutaneous before, and then I go intradermal to give superficial hydration of the wrinkle. Then I enter the lateral zygomatic area to give a bit of volume and support to the face. So I'm just constructing my support, I'm building up my face, and I went down, then I go up in the zygoma, and then I need to construct some support in the mid-cheek area. That's why those three access points. I go in the zygomatic area. Once again, in this area, I am in a safe place, so I can go quite deep. I go sovra-periosteal. In this case, I want to see a nice shape, a nice volume. I am injecting actually very small quantities. I'm still with the same 1 milliliter. For total treatment, I use 2 milliliter in this patient. I'm going in the mid-cheek area, and then I'm gonna use another milliliter to complete the treatment. This is the patient immediately after the treatment. You can see how I build it up. The mid face, I got a nice shape of the cheek, and I reconstructed the facial ogiva. This is a case where the patient went to have some lip filler. She had a very flat lip without any aversion, any volume. And so in this case, I used the Yellow Sweeties, which is the line for lips with lidocaine, as I said. But in cases like this, many times I use also the Yellow Intense. In this case, I applied no topical anesthetic because the filler itself has lidocaine. So I don't really need to apply any topical anesthetic. When I use the Yellow Intense, I start the treatment applying the topical anesthetic. I start always from the lower lip because I want to build up the volume of the lower lip, which has to be around 20% more than upper lip to respect proportion, a good proportion. As you can see, most of the times, I just have a single entry point in the center of the lower lip border. And from there, I inject the product retromuscular to get a nice lower lip eversion. Then I can complete entering along the lip like I'm doing in this patient, just if I want to give more volume. I'm going now in the upper lip. Once again, I enter at the lip border. I inject before lateral to construct my lip eversion. Then always entering from the lip border, I inject more medial. And this is the maximal volume that I give to the medial portion of the lip. I never inject the central lip in the lower part. In the central lip, in the central upper lip, I only inject, as you are seeing now, the lip border, just behind the lip border. In this way, I can get a beautiful shape and an important lip lift. You can see the comparison between one side and the other side. You can see how much the lip has everted and how much lip lift you got. And this is the patient before and after. And I just could show many lip treatment, but mainly I use the same technique in all cases, and all those lips that you see in the pictures are all made with 1 milliliter of Hyalur Intense. Just 1 milliliter. Each lip has its shape. No lip is the same like another, but in all cases, I can build a beautiful natural shape, natural volume. I can get a nice version with the volume concentrated in the lip itself and not in the upper part, which is quite unnatural. This patient came to me to have a better profile. She asked for a rhinoplasty and for a chin augmentation. So as I am a surgeon, I went to the OR for the rhinoplasty, nasal remodeling, and then I completed with the chin filler. You can see in this case, the setting is the OR. I'm using the Hyalur Sweet Dip, which is the volumizer with lidocaine to treat the chin. This is right after the rhinoplasty. I just completed the rhinoplasty and I'm going with the filler. I'm using 1 milliliter of Sweet Dip. I'm going just sovraperiosteal. I start from the sovraperiosteal plane, and then I build up the volume, injecting more superficial. I could have done this even with the Hyalur Intense. As I told you, the Hyalur Intense is the more versatile of all the Hyalur line. You can do everything with Hyalur Intense, but in this case, I use the Sweet Dip. I just use all the milliliter of hyaluronic acid. I complete the injection with some symmetrization. I'm just concentrated in the central part of the chin to give prominence and volume in this case, and to balance the proportion with the new profile of the patient and the new nose. And you can see the immediate post result with a more natural and balanced profile. Of course, she is more beautiful. In this patient, I used Hyalur Style to treat her nasolacrimal groove. I just want to show you the technique. Hyalur Style, as we said, we can use to treat fine lines, not big volumes. Maybe in this area, Hyalur Style is better than Hyalur Intense, and of course is better than Hyalur Restyle, because Restyle has glycerol inside and it's not very good for the nasolacrimal fold. But Hyalur Style is very good unless you use the right injection technique. You can see how I make some dots along the fold that I want to fulfill, and then I follow the dots and I go with my needle quite deep. I'm just injecting submuscular just to make an expansion in the orbicularis muscular fibers. And in this patient, as she had some lines also along the palpebra, I'm just injecting also very, very small amount of filler along the superficial line. This is the right technique. You don't have to see any bump, and you have to massage very well right after the treatment. I always complete the treatment of nasolacrimal groove also with a little bit of lateral injection just to fulfill all the periorbital area. This patient came to me to have some nasal remodeling with filler. She told me she would never have a surgical intervention on her nose. She just wanted to have a filler. So I did a rhino filler, what we call rhino filler. And so nasal remodeling with Hyalur Intense in this case. What I'm going to do, I'm going to regularize her dorsal bump, and then I'm going to remodel her nasal tip. When I do the remodeling of the nasal bump, I just enter at the point of maximal prominence. As I said before, if you go on the nose and you enter in the central nose, you are in a safe area, because main vessels of the nose you don't want to inject are just on the lateral sides, on the lateral walls of the nose. So if you go in the central part of the nose, always you need to aspire right after the insertion of the needle, but you are most of the times in a safe area. I'm just injecting small amounts of product. I'm just getting a little bump when I inject, and then I massage to get a regular profile. And when I remodel the nasal tip, I just enter in a point right between the columella and the tip lobule. In this way, I can inject before the tip lobule. I'm right between the skin and the dome of alar cartilage. And then from the same hole, like you can see, I go to build a columellar support, just to make a lift of the nasal tip. This is the immediate after. In this patient, as you can see from the frontal view, I also made a correction of the aesthetic dorsal lines, because she had quite a septal deviation, and on the frontal view after treatment, she has a straight light line. This is just to show you how I make right after the treatment. I do this type of taping with micropore. This is very useful to avoid any swelling of the nose. And I ask the patient to take this kind of micropores for 24 hours after the treatment. This is very, very useful, because the nose after 24 hours is has very few swelling, as a very good modeling. In this other patient, I did the same. You see the before and after. I did the same nasal remodeling, but just I'm showing you, because in this case I did not use Yalor Intense, but I use Yalor Style. Why? Because this patient had quite a thin skin, so I didn't want to use a very high concentration of hyaluronic acid. And with Yalor Style, I had a lighter volume, but I had the same and effective remodeling. Most of the cases when I use fillers, I like to wear the glove only on my left hand and not on my right hand, because with my right hand, I'm just handing the syringe, and without the glove, I just feel better the pressure that I apply to the syringe, and I can control better the small amounts, the small quantities of product that I need to treat some small changes. You see the little bump that I create when I inject, and then with massage, you see how the product is well distributed. The same, I do the tip remodeling. I enter and I go between to inject between the skin and alar cartilage. I create a support to the tip and I rotate the tip. Once again, I show you the pre and post. You see how the profile is straight and how the tip has rotated. Last case I show you because I did this morning, just to show you the potential, how much can change the nose, the use of filler. And in this patient, I used just 1 milliliter of Yalor Intense, and I remodeled the nasal dorsum and nasal tip, and I gave to her a very nice columella shaping, columella support. You see how much the tip rotated up and how much the columella extruded. So, in conclusion, I'm just going very long. Sorry for that. I hope I showed you some nice tips and interesting cases. Just my take-home message is, why should we change and switch to use the Hyalur fillers? I've been using them for the last 12 years, and I can tell you I had any problem using Hyalur fillers with the right indication. I had beautiful results, and most of the cases I had patients coming back and saying, oh my God, doctor, but this filler has lasted a lot, much more than my friend filler, or much more than I expected. And so patients were always very happy with this. Maybe some can think that if the filler lasts more, the patient come back less, but this is not true. We need to be happy if the filler lasts more, because that patient will be happier and will talk to other patients, and you will have more patients and more happy patients. So why should we use Hyalur fillers? Because they have a full range of products that allow us to treat any different kind of facial aging, and also to make beautification of young faces. They are very safe. They help us to restore volume loss. Those fillers have very much knowledge about cellular and biochemical process, so that they are very effective and safe. They have very less body response because of the fact that I told you that they have very low endotoxin levels. And you can combine the use of those fillers with new techniques, like the use of cannulas, because of their elasticity and low viscosity. And as I told you, they are very easy to extrude. So if you want to use a cannula, those fillers are very, very indicated. Thank you very much. Once again, really sorry for the technical inconvenience, for the technical problems. We really hope we can do this presentation again with all the doctors that have lost the presentation. Okay, I see on the chat that you asked if there is some question. Si alguien tiene alguna pregunta, ahora es el momento. Y bueno...
¿Me escucha, doctora?
Sí, ahora sí. Al final, combinamos.
Okay, qué bien, qué bien. Doctores, ¿hay alguna pregunta para la doctora?
Vamos a ver si había alguna pregunta antes.
Antes creo que...
No, porque todos estaban hablando que estaban escuchando bien. ¿Cuánto dura el efecto de los fillers? Bueno, yo diría que dura al mínimo 8 meses. Pero hay algunas áreas de la cara donde no hay mucha solicitación de los músculos, como el nariz, y allá puede durar hasta 18 meses, hasta, en algunos pacientes, hasta 2 años. Pero, por ejemplo, en los labios, los lips, la media es 8 meses. Es un poco más de todos los otros fillers. En mi vida, yo he utilizado todos los fillers que tienes en el market, y puedo decir hoy que Hyalur es el filler que tienes más duración en la mayoría de los pacientes. ¿Cuál fue la recomendación del tipo de ácido hialurónico en el dorso y la punta de la nariz? Y el recomendado para los labios. Bueno, como estaba comentando en la presentación, Yo utilizo en el nariz dos tipos, básicamente. En la mayoría de los casos, yo utilizo el Hyalur Intense, que es bueno para todo. Pero cuando hay algún paciente con la piel muy, ¿cómo se dice? Muy
Delgada.
thin,
Delgada.
que no es mucho grosa, es, ¿cómo se dice? Thin.
Delgada.
¿Cómo?
Piel delgada.
Delicada, bueno. Entonces, en los casos de paciente con la piel más delicada, yo utilizo bien el Hyalur Style. Y bueno, labios, mi favorito, y utilizo en mí misma también, es el Hyalur Intense. Sin duda, con Hyalur Intense, 1 ml de Hyalur Intense con la técnica que yo le he mostrado en la presentación, puede haber un resultado fantástico. Puede haber un buen volumen y también una buena eversión de los labios. For the under eye and tear through, tear through, yo prefiero utilizar el Hyalur Style, pero sí, bueno, tienes que tener una técnica muy adecuada porque si lo puede haber un poquito de edema. Entonces, puede utilizar el Hyalur Style, sí, pero hay que ponerlo submuscular. Si puede aplicar en pacientes con enfermedades crónicas como diabetes o alguna enfermedad autoinmune, bueno, no hay una contraindicación oficial. Lo sabemos que el ácido hialurónico ya está en nuestra piel y entonces ya traté muchos pacientes con esclerosis múltiple, con diabetes, con otras enfermedades del sistema inmunitario y bueno, nunca tuve alguna complicación. Pero claro que no hay que tratar pacientes con infecciones activas. Si hay algún absceso, si hay algún herpes, ahí no puede tratar, pero no tienes ninguna contraindicación oficial por pacientes con malaltía autoinmune crónica que no esté en una fase bien aguda de la malaltía, de la enfermedad. Y también lo que nunca yo trato son las pacientes con gravidez y que están amamantando, ¿cómo se dice?
Ah, sí, amamantando.
Bueno, esto yo no lo trato nunca porque no hay una evidencia clara que se pueda tratar. Entonces, cuando hay alguna paciente preguntando por tratamiento con filler en la amamentación, yo le digo de esperar al final y volver. Solo esto yo no trato. Cuidados posteriores a la colocación del ácido hialurónico. Bueno, lo más importante es masajar bien, especialmente en las áreas con la piel más delicada, como la área periorbitaria, como el nariz. Y también en los labios, lo que yo pido de hacer a los pacientes es un masaje por 1 semana después del tratamiento, como para ayudar la distribución del filler y evitar como bumping en los labios. Entonces, después de la inyección, hacer masaje, yo hago mucho, tipo como 5 minutos de masaje a la paciente, y después pido para hacer en casa por 7 días después del tratamiento. La mejor, bueno, por el nariz, yo hago el taping como le mostré siempre, pero es lo único que hago taping, los otros solo masaje. La mejor parte de los pacientes en la presentación son relativamente jóvenes. Bueno, algunas que eran bien viejas en los primeros casos. Lo que yo traté en vídeos sí, verdad. Pero lo que yo mostré las fotos tenía muchas con deep lines en la parte central. La que yo mostré que hice un tratamiento combinado con Restyle, Style e Intense. Ella tenía más de 60 años. Y bueno, cada área tiene su indicación específica. Entonces, para grandes volúmenes y para remodelación, bueno, Hyalur Intense. Para hidratación superficial, Hyalur Style. Para bioestimulación, donde ustedes quieren también tener un cooling de agua, un poco de edema, donde ustedes Restyle, porque siempre hay que pensar que Hyalur Style tiene el glicerol, entonces el glicerol la llama agua. Entonces, la pregunta que estaba viendo es la pregunta sobre la nose job, la rinoplastia, los efectos de la rinoplastia y si el paciente no gusta de la rinoplastia. Sí, bueno, el filler es perfecto para esto. Para pequeñas correcciones después de una rinoplastia, el filler es fantástico. Puede hacerlo, sí. Yo también lo hago y no hay problema si respecta la safe area que yo te mostré. Solo si te ve una rinoplastia abierta en la área de la columela, con el corte en la columela, hay que recordar que la vascularización de la tip, ¿cómo se dice? La punta, bueno, ahí sí está más delicada. Entonces, allá no puede hacer un overfill del nasal tip, pero puede sí hacer correcciones del dorso sin problema. No hay problema en el dorso. Hay que hacer un poco más atención en la punta si tuve una rinoplastia abierta. Pero esto no significa que no puede tratarla. Puede tratarla, pero poquito por vez. Sería mejor en casos como esto hacer el tratamiento, por ejemplo, en 2 veces. Yo haría así. Yo diría al paciente, la vascularización de la punta del nariz está un poquito más delicada por causa del corte, entonces vamos a hacer el tratamiento en 2 veces. Esto sí es más seguro. Bueno, recomendación y tiempo para aplicación en caso de oclusión o compresión vascular. Hay que ser rápido, hay que ser loco. Por eso, lo que yo digo siempre es tener en vuestro consultorio el ácido hialurónico y también la hialuronidasa. Si ustedes, por ejemplo, ven que la inyección fue intravascular, ahí puede ser muy bueno no retirar la guía, dejar en la piel, así que ustedes ya saben dónde está el vaso y trocar la siringa para hialuronidasa. Pero hay que ser rápido, muy rápido, inmediato prácticamente, porque si no, bueno, la vascularización puede ser compromisa y puede haber ya una necrosis, por ejemplo, si ustedes piden para la paciente volver el día después o algunas horas después. Entonces, si ustedes utilizan ácido hialurónico, siempre hay que tener disponible en vuestro consultorio también la hialuronidasa.
Doctora, ¿qué cánula recomienda para la aplicación del ácido hialurónico? ¿Qué medida? ¿Qué grosor?
Lo que yo mostré en las imágenes era una cánula de 25, pero como yo le dije, la característica más importante de los fillers de la Hyalur es el equilibrio que tiene entre la viscosidad y la elasticidad. Entonces, lo que yo recomiendo es también de utilizar una cánula de 27 gauge con los fillers Hyalur. Por ejemplo, mi favorita es 27, que es un poco más fina Y como que el filler no hay mucha fuerza de extrusión, no hay algún problema, el paciente ha un menor desconfort y el tratamiento es más seguro. Entonces, la cánula ideal para los fillers Yalor es la 27, especialmente para Yalor Intense, porque lo que yo más utilizo con cánula para hacer volumen en mi check en zigomática area y también en mandíbula es Yalor Intense. Entonces, en la mayoría de los casos utilizo Yalor Intense y cánula de 27.
Muy bien. En BM Pharma contamos con las agujas, las cánulas y también con hialuronidasa para tener en el consultorio para cualquier eventualidad que pueda suceder. Si no hay otra pregunta, doctores mexicanos y extranjeros, pues damos por concluida el webinar. Doctora María Grazia, muchas gracias.
Gracias a ustedes y de nuevo disculpa para el inconveniente técnico, pero esperamos que la próxima será más fácil.
Gracias, doctora. Y pues seguimos.
Hasta luego. Como se dice en español, hasta luego. Sorry for my Spanish.
Ah, no. Arrivederci, como dicen ustedes también.
Ciao a tutti.
Chao.
Gracias.
Chao. Bye.
Gracias.